So, Ritu, can we start? Ritu?
Yes, sir.
Yeah, I'm all
Where
ready.
are you?
Mute.
How are you, Dr. Ramasubramanian? Can
Yeah.
we take the black one out, Ritu? Yes. Hello, everybody. Greetings from IGCP Group, MedTalks, Indus, the makers of Aminopep. We warmly welcome doctors, pharmacists, and other healthcare professionals from Jamaica, Guyana, Bahamas, Cayman Island, Nigeria, and Sri Lanka. Indus Life Sciences has been promoting essential amino acids and zinc containing nutritional supplement in different parts of the globe for several years. The purpose of this webinar is also to reinforce the clinical significance of essential amino acids, including zinc. Essential amino acid and zinc assume even more greater importance during COVID-19 treatment and recovery as they are indispensable to boost immunity, which is the need of the hour. The webinar might attract CME credit hours in certain countries. So, dear colleague, I myself, Dr. K.K. Agarwal, the President of Confederation of Medical Association of Asia and Oceania, welcome you to this seminar, and we will be actively interacting with Dr. V. Rama Subramanian, who is a Senior Consultant Department of Infectious Disease, Apollo Hospital, Chennai. He is Director, Capstone Clinic in Chennai. He is a Professor in Infectious Disease, Shri Ramchandra Institute of Higher Education and Research. He is a member in the advisory panel to the government for COVID-19 management in the state. And we will be discussing on therapeutic goals of COVID-19. And let's listen to him, and then we will spend a lot of time in interacting with each other and answering all your queries. Ladies and gentlemen, and my dear colleague, I present to you Dr. Rama Subramanian.
Good evening, or should I say good morning to everybody. It is now 8 o'clock in the evening in Chennai in India, and I welcome all of you to the seminar. Thank you for those kind words, Dr. Agarwal. Over the next about 30 to 40 minutes, I shall be talking to you about the therapeutic goals of managing COVID. Can you see the screen right now?
Yes.
Right. Okay. So, welcome. We are now facing the pandemic COVID-19, and all of us are having difficult days ahead. And if I may quote the cliche term, the darkest days are still ahead of us, even though COVID has been rampaging for the last few months. Several parts of the world are going to face the worst in the coming months. So I think we need to prepare ourselves and set goals in how to handle this pandemic. Now, coronaviruses, these are a group of viruses which we have known for the last 5 decades or so. They are viruses which normally cause the common cold. They originally come from bats, but they have been found in several other mammals, including cattle, cats, and camels. Till recently, we had known about 6 types of coronaviruses. Basically, there have been only 4 over the last about 3 to 4 decades. And then these are the viruses which normally cause common cold. They are alpha, beta, gamma, and delta coronaviruses. But in 2002, we came across a mutation in this coronaviruses, which resulted in a condition known as SARS, or severe acute respiratory syndrome. This caused about 8,000 plus infections in the world in 2002. And this had a mortality of about 10%. About 800 people perished because of this. Fortunately, we managed to control this pandemic, and we have not heard of it since. But in 2012, there was another mutation in the coronaviruses, which resulted in a syndrome known as the Middle Eastern Respiratory Syndrome. Now, both these mutations arose from the viruses present in bats. Bats are asymptomatic with this virus infection. Subsequently, for SARS, the intermediary host was the civet cat. For MERS, the intermediary host was the dromedary camel. From both the civet cats and the camel, it involved man and then caused problems. The MERS also caused a similar illness like the SARS, but had a much higher mortality of about 35%. We only had about 2,000 and odd cases, and about 800 patients again died because of the MERS. We still come across an occasional case of MERS. So these have been the 6 types of viruses till last year, when there was a new mutation which occurred again starting in viruses which originated in bats. These coronaviruses are typically characterized by a corona or a halo or spikes around the enveloped surface, and these contain a single-stranded RNA genome. And probably towards the end of last year, it started in a wet market, a live seafood market in a city called Wuhan in the Hubei province of China. So the virus originated in bats and is believed to have passed through the intermediary, which was the pangolin, and subsequently affected man, and then has now spread from one person to another, causing a huge pandemic all over. This is an enveloped virus, which means it is very easily destroyed by simply soap and water, or even alcohol or bleach solution can destroy this virus. It is believed that the normal coronavirus, which affects only the upper respiratory tract, because of the mutation, develops the ability to infect the lungs also through the ACE2 receptors, which are found in the lungs, thereby leading to a pneumonia. The SARS coronavirus 2, which is what is now called, and that causes the disease COVID-19, has almost a 70% homology or similarity to the SARS coronavirus 1, which came out in 2002. This virus enters through the respiratory tract. It causes infection in the lungs by attaching to the ACE2 receptors. And from there, using the RNA polymerase enzyme, which is found in the virus, it reproduces and can be shed in the respiratory tract, and is transmitted from one person to another through respiratory droplets. It is believed, because it is attached to these respiratory droplets, when a person coughs, sneezes, speaks loudly, or sings, this virus attached to these droplets can come out of the nose and mouth and generally travel not more than 3 to 5 feet. So they generally infect only people who are very close to you. So if you have an infection, the droplet travels only about 1 to 2 meters at the most in most situations. Sometimes a violent sneeze can cause the virus to spread even 15 to 20 feet, but that is less likely. So most of the transmission occurs directly from a person to person through these droplets by coughing or sneezing. There is a small possibility of the virus also being transmitted through inanimate objects, or what we call as fomites. So if I cough or sneeze and this falls on, say, a table, or if I cough on my hands and without washing or wiping my hands, I touch a doorknob, I touch a telephone, and somebody subsequently handles the same place and takes their hands near their mouth or nose, they can get the infection through the inanimate object. A very, very small percentage of cases can also be transmitted by what we call as aerosol transmission, or the airborne route. So these are very small particles generated by violent coughing, by nebulization, by intubation, cough induction, mechanical ventilation. All these procedures, which are usually done in the hospital, can cause aerosolization of these viruses, which can transmit through the air, also known as the airborne route, and can spread much farther than a couple of meters. But this is typically in the hospital environment most often. Transmission can be through symptomatic persons, which is the majority. But since this virus can be transmitted even 48 hours before onset of symptoms, pre-symptomatic transmission is also seen. Now, when the SARS-1 outbreak came in 2002, We were lucky because a person generally needed to have symptoms for 4 days before he started infecting others. So this gave us time to isolate the patient and ensure that transmission was blocked. Whereas the SARS coronavirus 2 causing the COVID-19 has the ability to be transmitted even 2 days before a person starts manifesting symptoms. The incubation period, which is the time following exposure to the virus till the person develops symptoms, can vary anywhere from 1 to 14 days, but is a median of about 4 to 5 days. So after 5 days, when a person starts manifesting symptoms, the virus actually would have started the transmission 2 days even before the symptoms start and can go on for another 7 to 10 days. Asymptomatic infections are also seen anywhere from about 20 to 40%. And it is believed that asymptomatic persons can also transmit the infection, though less likely. Some of these are believed to be super spreaders who can transmit the infection to a significant number of population. Environmental factors, especially indoor environment, crowding, lack of ventilation, all of this also increases the risk of transmission. What are the clinical symptoms? Typically, the person may start with sneezing, cough, they may have chills, shaking, sweating, severe body pain and headache, sore throat, and surprisingly, 1/3 of the infected people can have loss of taste or loss of smell. The CDC has also included several other symptoms which may be non-specific, including diarrhea, a stuffy nose, and only presenting as fatigues and body pains. We also see several cases presenting with a picture like a myocardial infarction or even a stroke without the typical symptoms. So there is a huge gamut of symptoms with which this disease can present in various people. 3% of the population can have diarrhea. There is always a comparison between this COVID-19 and the flu. We believe that this is probably only a slightly worse form of a flu, but that may not be true. If you look at R0, what is referred to as the number of people infected by a single person, the flu, the R0 is 1.3, whereas COVID-19 is far more infectious. 2 to 2.5 persons can be infected by one single infected individual. So this is twice as infectious as the flu. The incubation period when compared to the flu is much longer. Flu generally has an incubation period of only 2 to 4 days, whereas this can go up to 14 days. The hospitalization rate is also significantly higher with COVID-19. Normally, only 2% of people with the flu get admitted, whereas almost 20% of patients with COVID require hospitalization. And the case fatality rate can be up to 10 times as much as the flu. Overall, keeping in mind the higher infectivity and the higher mortality, this is a far more devastating disease when compared to the seasonal flu. This table gives you the symptoms. Only about 40% of the people who present have fever. Eventually, 80 to 90% complain of fever. Cough is seen in about 60 to 80%. Progressive breathlessness, usually after a week, is noticed. Fatigue, body pain, sore throat, headache, chills, joint pains, runny nose, nausea, vomiting, and diarrhea can all be seen with COVID infection. We need to watch out for certain danger signals, which is tachypnea and tachycardia, the oxygen saturation dropping to less than 94%, and hypotension all indicate possibility of what we refer to as a cytokine storm, which results in multi-organ failure like sepsis.